Good morning, everyone. Thank you so much for joining me at Queen's Park for this important announcement. My name is Natalia Kusendova, and I'm the Member of Provincial Parliament representing the riding of Mississauga Centre. And I'm very humbled to be bringing forward my very first private member's bill. It is a big day for me today, and so I'm very grateful for all the support of my wonderful friends and colleagues that are here to support this cause. As a registered nurse working in the emergency room, I have witnessed the tragic results of the opioid crisis firsthand. On the front lines, I have heard from my fellow nurses, paramedics, and police services about the need to address this increasingly prevalent healthcare issue in our province. It is extremely important to highlight that there is an opioid crisis in Canada and in Ontario, and people are dying. Just yesterday, the Federal Ministry of Health underlined that the opioid crisis continues to be one of the most serious public health issues in Canada's recent history. Tragically, between January 2016 and September 2018, 10,337 Canadians lost their lives to an opioid-related overdose. And Minister Petitpas-Taylor also announced 33 new initiatives to develop educational resources for health practitioners on safer opioid use and effective treatments, control infectious diseases among people who use opioids, and provide effective evidence-based treatments and practices for people with opioid use disorder. Our mission is to combat the opioid crisis, and it is a battle that must be fought on all possible fronts. We at the Ontario government are doing our part, and Bill 105 is a crucial step in winning that battle. The goal is to save lives and give opioid overdose victims a second chance, a chance to get treatment and recover. As of January of this year, Canada and Ontario already have bilateral agreements on shared health priorities and will invest approximately $1.9 billion in targeted federal funding over 5 years as part of a 10-year federal financial commitment of approximately $4.2 billion to expand home and community care as well as mental health and addiction services. Ontario is doing its part by matching the federal government's $1.9 billion and developing a comprehensive mental health and addiction strategy for our province. In addition, under Canada's Emergency Treatment Fund, Ontario signed another bilateral agreement to invest more than $102 million, $51.1 million from the Government of Canada, and $51.2 million from the Province of Ontario to help increase access to evidence-based treatment services for people with substance use disorder in our province. Let me be clear. The opioid crisis is not a partisan issue. It is a human issue. And so I am pleased that I can work together with our wonderful Ontario Police Services to give them the tools they need to possibly save lives. Permettez-moi de préciser que la crise des opioïdes n'est pas une question partisane, c'est une question humaine et je suis ravie de pouvoir travailler avec nos merveilleux services de police de l'Ontario pour leur donner les outils dont ils ont besoin pour sauver des vies. On May 1st, 2019, I was proud to table my very first bill, Bill 105, the Mandatory Police Training Act, which would require all police services across Ontario to complete training on administering Naloxone. Earlier this year, the Solicitor General, the Honourable Sylvia Jones, advocated for much-needed changes so police officers would not be subjected to an automatic criminal investigation when they use Naloxone in an unsuccessful attempt to revive someone experiencing an overdose. It was the right thing to do, and a huge step in enabling police officers to carry out their duties without fear of facing a criminal investigation. Police officers are often the first to arrive on the scene of an emergency, and in the case of a medical emergency, they do what any first responder would do. They try to save a life. Police should be subject to the same rules as other first responders when administering this potentially life-saving measure. The Mandatory Police Training Act will ensure all police officers will be trained in recognizing the signs and symptoms of an opioid overdose and in administering Naloxone. We want each everyday hero of our police services across Ontario to have the tools and information they need to do their jobs and ultimately save lives. Ontario has some of the highest rates of opioid poisoning in the country, particularly in the cities of Thunder Bay, Brantford, Sault Ste. Marie, Belleville, and St. Catharines. We are also seeing these increasing trends in the region of Peel. By ensuring frontline officers are trained in recognizing the symptoms of an opioid overdose and in administering Naloxone, the Mandatory Police Training Act promises to put Ontario people first and save lives. en veillant à ce que les agents de première ligne soient formés à la reconnaissance des symptômes de surdose d'opioïdes et à l'administration de Naloxone, la loi sur la formation obligatoire de la police promet de donner la priorité à la population ontarienne et de sauver des vies. It simply makes sense. Our police are on the front lines, doing a great job. We cannot avoid the obvious facts that the opioid crisis is far-reaching and needs to be addressed. The numbers don't lie. In 2017, 3,996 people died from an opioid overdose in Canada. 1,265 of those deaths occurred in Ontario. 117 were aged from 15 to 24, and 6 just under the age of 14. In the first 6 months of 2018, Ontario recorded 629 deaths, and the number on the remaining months of 2018 and 2019 are still coming. We know that 60% of people die of opioid overdoses in their own homes. Last month, our staff and fellow MPPs received training on how to use naloxone right here at Queen's Park. As you know, naloxone is a medication that can temporarily reverse an opioid overdose, buying the sufferer precious time for medical services to arrive and provide further treatment. As a registered nurse, I believe it is vital that my constituents and members of the public feel confident and knowledgeable about the use of naloxone. I picked up my naloxone kit from my local pharmacy to be permanently available in my office. Naloxone is available at pharmacies for free and without a prescription across Ontario, along with instructions and training on how to recognize the signs and symptoms of an opioid overdose and administer the medication. If we can trust our everyday citizens to obtain and administer naloxone, how can we not afford the same trust to our highly trained police service members? We need to fight this in any way we can. And I believe mandating naloxone training for police officers across Ontario will be an important step. It respects the police and their unique and special placement in our communities and gives them the tools to save lives. I thank you for your attention, and I want to thank my guests who are joining me in support of Bill 105. Thank you, Allan Malek, VP of Ontario Pharmacists Association, Dr. Doris Grinspun, CEO of Registered Nurses Association of Ontario, Rick Frayne, and Darryl Gebien, former emergency room doctor and an opioid awareness advocate with lived experience. I would like to introduce Dr. Doris Grinspun, the CEO of the Registered Nurses Association of Ontario. Since 1996, Doris has been furthering RNAO's mandate to advance healthy public policy and the role of registered nurses and nurse practitioners. She's a friend and a mentor, and I'm honored that she came out today to say a few words. Welcome, Doris.
It gives me first great pride to see Natalia Kusendova as an MPP. Natalia is a person that we actually supported during the elections, an active member of RNAO, a registered nurse, and a person we're extremely proud. And of course, it gives us as nurses a great pride to see you introduce this bill today, Bill 105. The bill, if passed, will require all police officers, especially constables, First Nation officers, and inspectors, generals and inspectors, to successfully complete ministry-approved training and in the use of naloxone to respond to an opioid crisis overdose. With more than 3 Ontarians dying each day in Ontario of poisoning drug supplies, we are no doubt in the midst, I would say, of the greatest public health crisis that we have in our time here in Canada and in North America, as a fact. Having frontline officers trained and carrying naloxone across the province is an important element of a comprehensive approach to saving lives. And Natalia, you said it, saving lives is actually the goal. RNAO was reminded painfully of the critical role that police officers can play during this public health emergency when we were honored to be part of the Bradley Chapman inquest, where we also testified. Lessons learned from the Chapman's tragedy, opioid-related death, at an age of only 43. a father of 3, prompted the jury to make a number of recommendations directed to provincial government and police services. A key recommendation they made to the province was to ensure adequate funding so that police officers be trained and equipped with naloxone. So today you're bringing that to fruition, hopefully. The jury emphasized the need for specific elements in the training of police officers, including the need for effective first aid with airway management, administration of naloxone through hand-on scenario training, and anti-discrimination training that includes the participation of those with lived experience of using drugs. So we are very pleased that you have actually many of these elements right here in this podium. Compelling evidence was presented at the Chapman inquest on the fact that 911 is sometimes called in overdose situations because of possible police attendance in order to mitigate the danger of 911 not being called during these times of emergency. The jury recommended that officers should be advised to use their discretion with preference to not lay charges against persons at or assisting with the overdose call. RNAO supports these recommendations by the jury and urges that they be implemented as part of the ministry-approved training of law enforcement personnel. Enabling our frontline police officers to respond with naloxone when necessary will save lives, no doubt. In addition to this important measure, RNAO continues to urge the provincial government to expand access to consumption and treatment services, CTS, in all communities where there is a need for those services. And MPP Natalia, you just mentioned a few. We are aware of also others. The scope of the contaminated drug supply across North America puts our beloved families and friends, co-workers, patients, and neighbors at risk of premature death. Each preventable death is a unique and tremendous loss, not only for the family of the individuals involved, not only for their friends, in fact, for all of us as a community. The combined opioid-related deaths are causing life expectancy to actually decline in the United States and British Columbia. It is critical that we work together to prevent Ontario's life expectancy from joining that group. Let's prevent even one more death, unnecessary death due to the opioid crisis here in Ontario. And let me tell you, today we had in the front page of the newspaper the statistics from 2019. Over the period from January 1st to May 1st this year, we had 68 deaths from suspected opioid overdose, up from 35, so almost double the number of 2018. It's time to take action, and we hope that MPP Natalia Kusendova, you are supported all the way, and that we also follow the rest of the recommendations of the Brad Chapman inquest. Thank you very much.
Thank you very much, Doris. I would now like to introduce Allan Malek, Executive Vice President and Chief Pharmacy Office of the Ontario Pharmacists Association. Allan manages the OPA's health policy and advocates to facilitate and improve pharmacists' delivery of the best possible care. Thank you for coming.
Thank you, MPP Kusendova. Good morning, everyone. My name again is Allan Malek. I am the Executive Vice President and Chief Pharmacy Officer at the Ontario Pharmacists Association. In 2017, just under 4,000 Canadians lost their lives to opioid overdose. About a third of those, and MPP Kusendova mentioned 1,265 of those, were right here in the province of Ontario. Let's let those numbers themselves sink in a little bit because they're quite staggering. Under normal circumstances, I would say I'm happy to be here today. But please don't misunderstand. I am indeed honored to bring comments on behalf of the Ontario Pharmacists Association and its 10,000 plus members across the province. But it is unfortunate, however, that we are gathered here this morning to speak on matters relating to the societal scourge that is the opioid crisis. And today is an important one, as it marks the Ontario government's beginning of discussions on Bill 105, the Mandatory Police Training Act, to ensure that frontline police officers and others are appropriately equipped, supported, educated in the administration of life-saving naloxone treatment. Okay, I've got some more disturbing numbers. In 2017, Ontario Emergency Department visits due to opioid use reached nearly 8,000. That's an increase by more than 3,000 visits in the previous year. Between January and September of 2018, there were just over 1,000 opioid-related deaths in the province, and that's nearly half of the total number of opioid-related deaths across the country. Yes, the numbers sure are important. These ones tell a real-life horror story. They are also why I'm here today. We want to add to another set of numbers, but certainly not the ones I've spoken about. Instead, we welcome the addition of Ontario's police officers to the growing list of individuals who are trained and prepared to fight the war on opioid overdose. And in this way, all of us working together, we will be putting Ontario's people first, and we will be saving lives. So why are pharmacists here? In 2016, Ontario's pharmacists rose to the challenge and accepted the invitation to address the opioid crisis by dispensing publicly funded take-home naloxone kits, along with providing education and training on its use to any Ontarian asking for it, for themselves or for loved ones. Sorry, I've got one more set of numbers. As of January 2019, over 203,000 naloxone kits have been dispensed by over 3,500 participating pharmacies in over 400 cities and towns through the Ontario Naloxone Program for Pharmacies. Now, this makes good sense. It leverages the high accessibility of Ontario's community-based pharmacists who are embedded in the hearts of their community and are often open late. Can we do more? Sure we can. And it's why we continue to talk with the Ontario government on ways pharmacists can help prevent addiction to prescription painkillers by working together with doctors and nurses, nurse practitioners, dentists, and intervening when necessary to prevent inappropriate prescribing. And when necessary, pharmacists are working to increase patient awareness amongst the elderly and amongst others suffering from chronic pain on the importance of naloxone. There is a profound stigma associated with naloxone that it's only used for people who are utilizing using illicit opioids. This is simply not true. Pharmacists, nurses, doctors, police, and many others need to help break that stigma so that unintentional overdoses with prescribed opioids don't continue to take the lives of our neighbors, our friends, and our loved ones. But today is not about pharmacists, and it's really not about police either. Really, it's about numbers, and it's about lives. And the difference here is going to be in Bill 105 and getting naloxone into the hands of those ideally suited to administer it, Ontario's police officers. And with passage of MPP Kusendova's bill, pretty soon we won't be talking about the number of lives lost to opioids. Instead, we'll be talking about the lives saved from the brink of overdose. Thank you.
Thank you, Allan. Next, I would like to invite Mr. Rick Frayne, who is a lifelong Mississauga resident. His personal experiences and loss of his brother, as well as others in his community, prompted the Rick's need for establishing community awareness into the opioid crisis. Combining good music and great information has made for Music with a Message, a working title for a work in progress towards ending opioid-related deaths. I invite him to say a few words.
Thank you, Natalia. I feel very much at home. I'm married to an RN, so I'm used to taking orders from nurses, and I know that they do a lot of the heavy lifting, and a lot of that's being done in our legislation today and onward. I'm here because I don't want another person to have to do something that I once did, which was to walk over to some other nurses to have to tell them that it was time to take my brother off life support. My brother was a professional in the construction industry who had unfortunately suffered some injuries that were severe enough to have to be prescribed opiate pain medication. His family, myself included, did not know the degree to which he was using opioids. His use turned into misuse, to addiction, and consequences. He suffered a hard withdrawal and a respiratory arrest with some complications and a flu that led to him arresting in hospital, being revived, and then having to be put in ICU. Awareness of the family and the physicians that would have been treating him could have been heightened. And that's what awareness is about. That's why I think we as families and friends and loved ones of anyone who is using opioids need to be in the know of what they're using and how often. My brother was a great fan of music, so inspired by the unfortunate and recent accidental fentanyl overdose of a friend's son named Cody, we decided to kick up some awareness in one of our local establishments and bring in some music. And in organizing that, more than 6 degrees of separation came together. There were so many people whose lives had been touched and affected by the opioid crisis in a deadly way that it was astounding. We have a young man named Corey, who is someone who was affected by dose of accidental fentanyl ingestion that caused him to flatline and be revived 3 times. Luckily, his mother was an ICU nurse and found him in time. But his friend suffered symptoms, very severe symptoms, just from touching the controls on the video game they were playing with. That exposure and that deadly, minute amount can be subjected to our police officers very easily in the course of their work. So not only is naloxone something that can be used to revive and resuscitate victims of an overdose, but possibly a police officer who's been accidentally contaminated with fentanyl or opioids. We lived in a time when it was once considered a luxury or frivolous for police officers to have air conditioning in their car, to have fancy things like pepper spray, tasers, batons. These are all now standard tools of the trade, things that they use regularly on a daily basis. I would put it to you that they should also include now naloxone, standard across the province. As a business person, I travel from Windsor to Winchester, Fort Erie to Fort Francis. This problem is very serious in every community. Communities coming together to talk about this are very critical. People that can help each other to help each other, whether you are a frontline first responder, a politician, or just somebody who knows how to get a group together, it's worth putting it on. We've done it, and we've been able to reach out into the music community and to have some very inspiring messages put forth. We heard from one of the most profound spokespersons in the business, Alice Cooper, sent us a special satellite message to talk about losing his friends like Janis Joplin, Jim Morrison, Jimi Hendrix. He also spoke to something that shocked a lot of us sitting here in Ontario and saying that marijuana cigarette could also be just as deadly. In today's news, 2 young men in Milton were admitted after suffering serious symptoms due to apparent fentanyl ingestion. So this is very fresh and very present. I would just like to say that if we can focus on something that's been spoken to in this legislature, efficiencies and savings, and turn that into an across-the-board savings of lives and an efficiency that we won't be crowding our waiting rooms and our emergency rooms with opioid cases, that's a good thing. So congratulations on your work, MPP Kusendova, and thank you for making us a part of it. Oh, I'm sorry. Pardon me. I neglected to introduce my colleague, Dr. Darryl Gebien, who I met through reaching out into the community and finding out that he had some very interesting and extensive experience in the field of opioids, and he can speak to that. But I would also just like to say that in a situation and an issue where it's very easy to stigmatize, that has to stop, because as Darryl will allude and expose, if it can happen to him, it can happen to anybody.
Thank you. Hi, thank you. I'm Dr. Darryl Gebien. I'm an emergency department physician. I'm not practicing currently due to a near-fatal fentanyl addiction. So I'm in recovery over 4 years from an opioid addiction. And I'm proud to be here, and thank you very much for having me. This is incredibly important to equip our police officers across Ontario with this life-saving kit. A Narcan kit can reverse an overdose very quickly, promptly, and can revive people. Hits close to home for me as well, because I also lost my mother to an unintentional fentanyl overdose. And we have to remember that it's the elderly population who are on opioid medications, as Allan alluded to, that they can unintentionally overdose, and that's exactly what happened to my mother. Now, this was back in 2015, and unfortunately, the paramedics at that point didn't ask my dad, more details about what happened. But had they asked if she was on opioids, then they would have probably given Narcan and could have saved her life. So things have changed tremendously over the 4 years. I don't blame them, but things have changed since then. So it's very, very important to the family as well, responsibility on the family to bring in a Narcan kit, have it there if they know that their loved one is on opioids, whether it's prescribed or illicit. Just a little bit about the importance of naloxone. So if somebody is overdosed, possibly that they're blue or they stop breathing, it's really important. Artificial, like giving respirations, is part of the treatment as well, and it's very important that we have to give that out there as well. The Narcan kit, while a person is preparing the kit to give it, we can give artificial respirations and compressions. So mouth to mouth is what I'm talking about. It's very important to consider that as well from an emergency department physician's perspective. Yes, partial exposures from police officers to environmental, fentanyl that's perhaps in the air, if it causes any symptoms. But Narcan, what the opioids do is they can shut down respiration. So it's important to treat respiration, respiratory arrest, and that's where the Narcan comes in handy. On my final point, I just want to say that this is an excellent step in the right direction. This is a very big, complicated process of what we're dealing with, the opioid crisis. It runs very deep, and I want to say that the opioid crisis is just one symptom of a bigger problem, and that is systemic anxiety, really. I think that's a lot harder to tackle, and this is a much simpler decision to be making at this point. But the treatment starts with getting communication and people to start speaking and sharing their stories. And that's one important thing for me to do as an emergency physician, to help destigmatize by saying, yes, my name's Darryl Gebien, I'm an emergency physician, but I'm also somebody in long-term recovery. Now that's important because it tells people it's okay to share and talk and bring up the dialogue. And this is what helps this anxiety. And I know it's a complicated thing, it's not related to this issue today, but it's important that we do start treating the problem rather than just the symptoms. So thank you very much, a great step in the right direction.
Thank you very much. So as you see, the opioid crisis affects people from all walks of life and all professions. I want to thank all of my speakers for being here. And unfortunately, we are running out of time, so I could take maybe one question if there are any.
Est-ce que vous pouvez nous expliquer, dans le fond, qu'est-ce qui se fait actuellement? Parce que je sais qu'il y a des policiers qui ont des trousses de naloxone, donc ça serait vraiment... c'est quoi l'importance de cette prochaine étape-là?
Alors, on voit qu'en Ontario, il n'y a pas une stratégie qui est la même pour toute la province. Il y a des forces de police en Ontario qui ont déjà les kits de naloxone et qui ont déjà l'entraînement pour utiliser le naloxone. Mais ce n'est pas le cas dans toute la province. Alors, ce projet de loi va faire sûr que toutes les forces dans tout l'Ontario sont entraînées dans l'administration de naloxone et aussi pour reconnaître les signes d'une crise d'opioïdes. Oui. Merci.
Are there any plans in place for firefighters to also receive Naloxone training province-wide?
So at this time, that is not in place. At this time, we are looking at police forces receiving the training, but that is a great idea.
Are you finding that police forces across Ontario, you must be finding it if you're mandating it, that they're not voluntarily training themselves in administering this?
So through the Solicitor General and Ministry of Attorney General, we have been consulting with frontline police officers and police forces across Ontario. And what we have found is that most of the police forces are on board and are already training their officers. But we want to make sure that all of our frontline men and women in uniform have the tools that they need. You know, knowledge is power, so we are empowering our police officers to save lives.
J'avais une question sur un sujet séparé pour la médecine régénérative. Je sais que vous avez travaillé dans le domaine de la santé puis de la médecine. Je sais que le gouvernement dit que les investissements privés peuvent financer cette recherche-là, mais ce qu'on nous dit dans ce secteur-là, c'est qu'il faut un financement public pour ensuite attirer les investissements privés. Donc pourquoi couper ce financement de 5 millions par année pour la médecine régénérative?
Alors, comme vous savez, notre gouvernement s'engage à protéger ce qui compte le plus, comme notre service de santé et l'éducation. Alors, on fait des investissements dans les domaines qui sont prioritaires pour ce gouvernement, comme la santé mentale. On fait un investissement de 1,9 milliard.
Spécifiquement sur ça, pourquoi pas la médecine régénérative?
I'm really sorry. Can we actually take the questions outside because we have to gear up for the next guest? I'm so sorry.
Okay,
Merci. Thank you so much. Thank you.